Hi, I'm Allie.
I'm Pat.
Hi, Pat. Welcome to Pathways. Before we get your session started, I just wanted to talk to you about some confidentiality. Um, Here we work together as a team, so some of the information that you might share with me, I may have to share with some colleagues, and this will just be that I can get some more information that I can better serve you and help you through our sessions. Um, what you say here most always stays here unless given a reason to have a breach in confidentiality. And if I think you're going to harm yourself or someone else, or that you're neglecting a child or the elderly, I may have to report that. Or you can also sign an agreement that I can speak to someone else as a collateral contact, like a family friend or a family member, or even another doctor. Do you have any questions about that?
No.
Okay. So we'll just start off with some basic questions, kind of get some information about you. Pat, how old are you actually?
I'm 35.
Okay, you're 35. All right. Why are you here today? What's really brought you in?
I really just came here to get my family off my back. They think I have some problems.
Okay. Um, well, I would like to let you know that although you may feel like you're only here to please them, this is a big step for you just coming in and kind of experimenting and seeing what's really here that we can offer you. What is it that your family thinks you have a problem with?
They think I have an addiction problem.
Okay. What is it that you are addicted to or that they think you are addicted to?
I use heroin.
Okay. And how long have you been using heroin?
A little over a year now.
Okay. Is that something that just kind of happened, or did something cause this to happen where you led into the use of heroin, or how were you introduced to it? Is really what I'm trying to ask.
Well, I started with oxycodone, which then led to Percocet, and heroin's just a hell of a lot cheaper. So that's where I'm at now.
Okay. I like your honesty. That's really important when we have these sessions, is that you're honest with me and open about the situation. So you said you were taking oxycodone, is that correct?
Yeah.
And Percocet. Why were you taking those? Was that a prescription, or was that something that you were getting from someone else, not a pharmacy?
It was a prescription.
It was a prescription.
Yeah, it started out as a prescription.
Okay. I'm just trying to find out some history. What was the prescription? Why did you have a prescription for oxycodone?
About 10 years ago, I was in a car accident. I was on my way actually to my college graduation, running a little bit late. I ran a red light, a car hit me, um, that caused a lot of uh, back pain and stuff for me, so I was originally put on oxycodone.
Okay. So you were put on for pain control. Um, was that something that you took like as directed, as your prescription said, or did you just take it whenever you needed it?
For a while, I took it as directed. Then it started. I noticed I was taking it more frequently. It started running out. So then I just started taking it like as I thought I needed it, not necessarily as it was prescribed.
So you were kind of becoming dependent upon taking that in order to be able to function,
Yeah.
right? Okay. Has there been any event of use for the heroin in the past couple days?
Yeah. I regularly use, so
Okay.
about an hour ago is probably my last.
Oh, wow. Okay. Um, so I know that we're in this session. I do want us to have like the clearest mindset that we can to like get our most honest answers from you. So how are you feeling right now? Are you currently high as we're talking, or do you feel like you're in a normal state of mind?
I'm coming down. I wouldn't say all the way normal. Uh, just kind of coming down from the high.
Okay. Well, if any of the questions you feel like you can't answer them, feel free to let me know that you don't know the answer or you don't know how to answer them to the best of your ability. And I just encourage you again to be honest with me with the situation. Um, so you said that you're here because your family has asked you to come. Are they expecting you to get something out of your treatment, or do they think that you're going to stay for other sessions? Do they understand that maybe you're just doing this once for them?
Um, I think they will. They hope that I will get treatment or continue sessions, but they also understand that I'm just really doing it to get them off my back because they've just been bothering me about it.
Bother you?
Mm-hmm.
Okay. Um, so you told me that you had previously taken the oxycodone for the back pain. Have you had any other treatment for medications? Have you been on anything else? Have you had any other psychiatric treatment?
Um, I didn't like see a psychiatrist for anything, but my family doctor explained to him about like the depression and anxiety, mainly just because of the accident and stuff. So he put me on Xanax.
Okay. And is that something that you're still taking, or you're are you not taking that anymore because of the heroin use?
No, I'm not. I don't take it anymore.
Okay. Um, let's talk about some things that are going on in your life right now. And like I said, I just want to be honest. And if you feel like you're not comfortable answering, that's fine. And where do you see like the most problems in your life right now? Is it at home, or do you have a job that maybe is causing problems?
No, I haven't been able to hold a job due
Okay.
to just the pain when I'm not using.
All right. So has that put any financial stress on you, or are you living with someone else that's taking care of your finances?
No, it puts a really big strain on finances, just because I'm always trying to. Drugs are the most important. It's the one thing I focus on. So.
Okay. Have you noticed anything different about like since you've been using heroin? Um, any different in your appetite or sexual behavior or anything? Is that causing you to be different?
Yeah, I don't have much of an appetite or desire to really do anything other than heroin.
Okay. Your honesty is greatly appreciated. Um, how are you feeling about sleep? Are you sleeping a lot? Not sleeping a lot? Not sleeping at all?
Um, I don't. I don't have a good sleep pattern. Um, some days I can go on 1 or 2 hours of sleep. Other times I can sleep for pretty much the entire day until I start feeling like I need drugs.
Okay. What's on your mind right now? I just noticed that you kind of feel like you might be a little preoccupied.
Um,
Is this making you nervous? Are you feeling a little out of your ordinary right now? Being able
yeah,
to talk about all this?
yeah, it's hard.
Okay. Um, I know that as we're talking, I'm trying to keep your attention and keep your focus. Do you feel like that's something that's hard is to pay attention, or are you feeling okay?
Um, it's sometimes it's hard to focus. There's a lot of other things going on.
If we continue the treatment and some of the sessions, do you feel like your family will stand behind you and support you?
Yeah.
Definitely.
Mhm.
Okay. And do you have any children?
No.
So I want to talk about some history, some trauma history in your life, if that's okay. Have you had any history of physical neglect or abuse?
Mm-mm.
What about sexual abuse?
No.
Emotional abuse? No. Um, have you had any other traumatic experience? I know that you talked about the car accident. Do you want to tell me more about that accident? Said you were on your way to your college graduation.
Yeah. So I obviously graduated, didn't get to walk. I had a bunch of things lined out. I had a job waiting for me, all that kind of stuff. So that was really the most traumatic thing that's happened in my life is that it was just like 1 second I had everything, and then the next thing I knew, it was all gone. And now here I am, 10 years later, and I have nothing really to show for everything that I worked so hard for.
So, did you ever think about, even though you still graduated college, correct? Like you still got that degree. Did you ever think about maybe what you could do with that degree? Maybe, or what could happen if you went through treatment and you were no longer using drugs, that maybe you would be able to do something with your degree and maybe change that outlook on your life?
Yeah, I've thought about it, um, but then I just also think about how in between uses and even years ago, like I've never just been able to manage the pain, so I don't know if it would be something that I can ultimately overcome.
Have you ever tried to stop using the heroin before on your own?
Yeah, I've tried a couple times, um, which I guess is why I kind of felt like I don't necessarily know if I would consider it a problem, because I have like quit before.
Okay. So, how long was your span that you considered quitting from the time you quit using to the time you restarted using?
Um, a couple weeks.
A couple of weeks. Wow, that that is good that you were able to quit for that long. Um, During that time, did you notice any type of withdrawal?
Yeah.
Yeah. What kind of symptoms did you have during that time?
Um, a lot of uh, restlessness, nausea, just like basically pain all over, not just like the regular back pain that I've been suffering from. Chills.
So was it because of the withdrawal symptoms that you started using again, trying to get rid of those, or was there something in between then that made you feel like, oh, I just can't go on without using
Um,
again?
I guess just a little bit of both. The withdrawal symptoms are hard to overcome, especially if you're in an environment where you know that you have the one thing that can stop them. But then even sometimes when you just start thinking about things like how do you go up from here, that just kind of makes you just want to get high.
So I do want to ask you a couple more questions, and like I said, I just need your answer for some of these. And again, if you don't feel comfortable answering, just let me know. So far, I've noticed a lot of honesty and openness with you, and I really appreciate that because that lets me get to know more about you and more about how we can really address the situation at hand. Um, so, like we said, you do have a support system if you were to choose the path of treatment.
Yeah.
Okay. Um, and you said you have no reported abuse or neglect from those around you, and severe financial problems.
I mean, yeah, right now.
Okay, what about like physical problems? Or still suffering with the back pain?
Hmm.
Have you lost anyone recently, personal in your personal life, through death or someone who's just not a part of your life anymore?
I mean, I've basically lost all of my friends. Um, Now the only people that are like considered friends are other users who wouldn't really do anything for me because they're just looking for their next high too. So
Okay. Have you ever had any thoughts of suicide or self harm?
um, I mean, I'm not going to say that I haven't, but it's not something that,
Is it a
oh,
current
no.
thought? No. So I just want to kind of get like some feelings from you right now. Um, if you could use 3 words to really describe your emotions right now, what would those be?
Um, angry, um, hurt, lost.
Okay. And is that those feelings? Is that something that you're feeling because of some of the situations that have gone on in your life, or because of the pain, or is it kind of a combination of both going on right now?
It's a combination of both.
So it seems like there's really been a lot that you've had go on in your life, and a lot that we can talk about in the future. If you want to, we can pursue treatment, and I can kind of look at what we went over today and see what is the best path for you. If you're interested in pursuing the treatment, I'll let you think about it. If you want to call me, we can make another appointment and another session to really work this out. It was really great to meet with you today, Pat.
Thanks.